Welcome everybody. I'm Katherine, Leith. I'm faculty in the College of Social Work. I'm a member of the faculty group that makes up the Aging Specialization Work Group. And we wanted to, in recognition of Healthy Aging Month, which September is Healthy Aging Month, we wanted to hold a lunch panel series every Tuesday. This one is the first one where we discuss particularly aging, employment, opportunities for social workers. And every panel session focuses on a specific setting. And today we have government and related agencies. So it's my pleasure to introduce to you our panel. We have Ms. Michelle James from the DIEC, the Department of Health and Environmental Control here in Columbia. We have Ms. Cindy Curtis at the Central Midlands AAA, the Area Agency on Aging. And we have Ms. Maria Patton, who's at the South Carolina Vulnerable Adults Guardian Ad Litem Program. So I'll give you a brief intro for both, the introduction for all three of them, and then we let them talk, and then we'll open it up for questions and answers. Okay? So I want to start out with Ms. Michelle James. Ms. James has been at DIEC for 12 years. She started out as the Assistant Director of the Office of Minority Health, where she was responsible for program development, planning and implementation, translating programs from the state level down to the community level. She's now the Healthy Aging Director for the Healthy Aging Unit at DIEC. She's been doing that for about 2 years. And she is one of the primary focuses of that program is chronic disease self-management. He's still doing that. All right. She has an MSW from the University of South Carolina, of course.
Where else?
Next, I have Ms. Cindy Curtis. Ms. Curtis is an award-winning older adult wellness program manager and serves as the director of the Area Agency on Aging at the Central Midlands Council of Governments Area on Aging. She's been doing it since 2014. Ms. Curtis is a graduate of Columbia College and obtained her Master's in Social Work also from the University of South Carolina. Ms. Curtis brings a wealth of experience working with the older adult population, including senior centers, hospital programs, assisted living communities, healthcare centers, and independent living communities throughout the state. Ms. Curtis's background includes successful grant writing and grant management, and one of her many awarded grants involved developing a caregiver support program for a non-for-profit organization and authored a comprehensive caregiver resource and information guide published and distributed to caregivers statewide. Ms. Curtis was awarded the 2010 Innovative Program of the Year Award from the Leading Age of South Carolina. She continues to follow her passion by providing the leadership and program management skills to aging programs here in the Central Midlands community. She's also licensed as a social worker, LMSW. And finally, Ms. Maria Patton. Ms. Patton presently works at the Lieutenant Governor's Office as the director of the South Carolina Vulnerable Adults Guardian Ad Litem Volunteer Program. Ms. Patton has over 36 years of experience working in state government in the area of long-term care. She served for 9 years as the long-term care ombudsman in the governor's office. I actually met Ms. Patton. You were at BHHS.
I was.
Yeah, and she was there working, I think you were working with Medicaid.
I was with community long-term care.
Yeah, yes, okay. Ms. Patton is a workshop presenter for several groups, including the National Association of Social Workers annual conferences, the South Carolina Gerontological Association, and the University of South Carolina School of Social Work, and the Summer School of Gerontology. We've done that at a few sessions to get that off the ground again. Those of you old enough will remember we used to do that a lot. Ms. Patton has a bachelor's degree in sociology from USC. She holds the graduate certificate. She's a graduate certificate program holder, also from USC. And she's a certified public manager for the state of South Carolina since 2003, and a state of South Carolina certified care manager. She's also a qualified interpreter of Spanish. So please join me in welcoming our esteemed panel. Coming over to the panel, what I'd like for each of the panelists to do is just briefly tell you what her position is, what she does in government, and then we're going to open it up. We're going to spend a bulk of the time on your questions and have our panelists answer them. We've also brought some materials, so please stick around afterwards. You can ask questions if you don't have to go to class. And they'll give you those handouts. All right. I'm going to open the floor. Michelle, if you don't mind starting maybe, just tell us a little bit about what you're doing.
I'm the director of the Division of Healthy Aging at DHEC. I'm housed under the Bureau of Chronic Disease Prevention, the name is very long, Prevention and Promotion, Health Promotion. It's not right, but it's the Chronic Disease Division. And what we do is we really kind of look at the aging population of South Carolina from the health perspective and try to figure out how we can keep that population healthy. Primarily right now, we're focusing on arthritis because that's where our funding is coming from, the CDC. So we have several programs we promote across the state to work with partners to implement them within the community. And one is a chronic disease self-management that she mentioned, that Katherine mentioned, and the other two are physical activity programs. We're also kind of moving into another area. We just recently received a grant from the Alzheimer's Association to raise awareness of dementias and Alzheimer's disease. So we're going to be working with the Alzheimer's Association, the Lieutenant Governor's Office, AAAs. We all work together and promote this across the state. We're not just targeting older people for these workshops. We're targeting people from 18 up, because they're the people that need to know what those signs and symptoms are. So our whole goal is really to make sure that you're aging from a healthy perspective, and from the social work perspective, I bring the program planning and the evaluation and the different strategies.
Michelle, could you tell the students then to what extent that opens up opportunities for them for employment?
There's so many things you can do with your MSW, truly. I started in direct service years ago, and I came back to school. Cindy and I actually were in the same class.
We figured it out. Years later.
And after I graduated, before that I was working for the Lieutenant Governor's Office on Aging, which was then called Senior Services. And when I was there, I was actually monitoring senior centers across the state and looking at them and making sure that they were addressing health issues. I was also monitoring the home delivery bill program and things like that. So I've had a background in healthy aging, so I've kind of ended back up in it, which really is my passion, because I think that what people don't realize is that you have to age healthily through your whole lifespan. You don't wait till you're old to start taking care of yourself, or older. You need to take care of yourself all through your lifespan so that you have a healthy life and don't have the chronic conditions or have them and can manage them well. So as far as opportunities, there's many things you can do. You do program planning, development, evaluation. A lot of people are into evaluation of programs, because what we do is we find evidence-based programs and implement them. And so they have to be, you have to do research to find those programs, implement those programs. So you're planning, you have to pull partners to the table, so that's part of your partnership development. There's so many different things you can do with it. I've done the community work, I've done work from the state level, I've worked with things nationally. So pretty much whatever you want to do is wide open to you in public health. And once you get into it, you realize there's so many more opportunities for you, because you're not just pigeonholed with the degree, especially once you get the experience behind you of the fundamentals of public health. I started to go back for my double master's, public health and MSW, but didn't. Considered going back recently, but I'm not. Because I feel like I can still move forward with the experience that I have in the field. Since I've been in it for about 15, 20 years, I think I have experience, and I have it from different levels. So it depends on what you want to do. If you're interested in research, you can do that. If you're interested in evaluation, you can do that. Program planning, implementation, partnership development. Pretty much everything you learn is the basic tenets of social work you put into perspective into your job with this type of work.
Thank you. Cindy, what about you? What's been your experience?
Oh, everything. I've worked mental health, I've worked organ donation, I've worked in the school, the Richland County School District 1, which is the second largest school district in the state, doing school social work, but program development with a dropout prevention program. So, I can say when I went back to school, it was going back and wanting, and I remember one of my colleagues said she was going to go into the geriatric certificate program. I was like, what are you going to do that for? She's now running one of the most successful senior service, in-home senior services, and she's doing quite well. She went into it when it was the thought of getting some services into the home and helping out somebody elderly. Wow, what's up with that? Well, now, here I am with the Area Agency on Aging, and I can tell you that market is booming. That is the fastest growing. I saw it grow with also home health services, which is paid for by insurance. So if the doctor orders it, you're going to get home health services, and they have social workers that they hire. You're going to have it if you have hospice services. That's also covered under your insurance. Guess what? They always hire social work as part of that team to come in and help that person. So there are huge markets that not only are supported under the Area Agency on Aging. They're in every state, in every region, because we're supported by the Older American Act of 1965. So there is a AAA director. There is a family caregiver support advocate for all those caregivers that are in the home taking care of their loved one. It could be, we have our student here that she is interning and doing quite well at our Area Agency on Aging. She's working in the Family Caregiver Support Program. We have hundreds of thousands of caregivers around the nation, and these are people that are caring for their loved one. It could be somebody as young as a granddaughter taking care of their grandmother. Of course, it could be that elderly spouse taking care of the other elderly spouse. It can, any kind of scenario, there are caregivers out there. We issue respite vouchers with our Family Caregiver Support Program. So plus we do support groups, and we always have guest speakers coming in for the caring for the caregiver every third Thursday, and it's somebody out in the community that's working with the elderly. All those agencies that, you know, they have their people that are working there to have an expertise on stress busters or how to handle, you know, the tension, how to handle Alzheimer techniques, you know, with redirecting so you don't get frustrated and mad because they never remember anything. We also have the Information Referral and Assistance Program. That is like our gateway to any question. We get dozens and dozens of calls every day with people saying, where can I get eyeglasses? Where can I get rental assistance? Where can I get transportation? My mother needs a hot meal. She can't cook anymore. Where can I get a home delivered meal? So we have dozens and dozens of calls in every Area Agency on Aging that is handling it. We have, and of course, you know, you can be an information referral and assistance specialist. We also have the Ombudsman program. That's also mandated by the Older American Act. This is where the investigators are going in, social workers going in and investigating any neglect or abuse in a facility, a skilled nursing center, otherwise known as the more politically correct is calling it a healthcare facility. So, but some of them are absolutely awesome looking. I mean, you know, you got to convince your grandmother it's not that, you know, smelly white, you know, nursing home that you know, these places look so posh and deluxe. Some of them are just outrageous. So we have the Ombudsman program, the Information Referral Program, the Family Caregiver Support Program, and the Information Referral and Assistance. There is an area agency. How many of you are from out of state? I was talking to a young lady. All right, go up and look and see who's serving your Area Agency on Aging. What I do is I give contracts out to the Council on Aging, to my counties. I serve 4 counties, Richland, Lexington, Newberry, and Fairfield counties. With that, I have contracts with my Council on Aging that I give them money for congregate meals, I give them money for home delivered meals, transportation, and also, which is really important, well, it's defined as either home care 1 or homemaker. That's somebody going into the home and you can't really do all your housekeeping like you used to. And so it's somebody coming in and helping you with your housekeeping. It's amazing. If you can imagine wearing a suit that weighs about 300 pounds and you can't turn your neck, that's what it feels like when you're older. You just get really tired and you can't do the things that you're doing. So a little bit of help in the home is called homemaker or home care 1. The other one, where there's a lot of seniors needing help in the home with home care 2 or personal care, that's giving them a bath, okay? That's helping them with their home environment, keeping it neat, maybe running to the grocery store, but helping them bathe. So these are very essential services because you want to stay in the home. How many of you, when you grow old, want to go to a nursing home? What, no one? Not a soul? Well, you're thinking about it, you're on the fence. You want that really nice one? Yeah.
That'd make good money.
That's the jazzercise classes and everything. No, nobody wants to leave their home. And that's why one of the markets that is just growing exponentially is the in-home care agencies. Well, they have to have people and social workers and program managers running all those things. When I started in working for the Area Agency on Aging, and I was hired under contract in 2013, It was to just, we had probably like, I don't know, 26 in-home care agencies. Now we work with a license of 108, you know, and it's now, in 2014, DHEC required that you had to have a license. That's finally they got to regulate them. So there are these agencies and services that are offshoots of helping seniors in the home. Senior movers, Senior Movers on the Move, another new company. Why? Because seniors, when they do have to leave their home, they can't sort through everything. They can't go through all their boxes and clothes and furniture, and so you have somebody that goes in there. Well, that's another paid service. So there's lots and lots of services that are now surrounding this growing population, which by the year 2030, 1 out of every 5 Americans will be over 65. Can you say that about children and women's program? No. And they're also, you remember, not all of them are going to be poor. Some of them, I mean, they're going to be older people that want to have the services in the home. They want to hire a reputable agency and get that help in the home. So some of you might start your own company because you know these services. I mean, if you're a good, sound business person, you might be able to say, you know, I want to be my own boss. And I think my area where I'm living needs another service like this. There's also, how many of you have heard of assisted living? Okay, or do you know what a CCRC is? Which is a continuing care retirement community. That means you can go in there and you can be as independent as myself and have to live in a cottage or an apartment or a condo. That's called independent living. Well, as I age, I might need that assisted living. And I get more chronic and health problems, I might need to go to the health care center. Or maybe I get dementia and I really need to be put in that memory support unit. Well, a CCRC is where it has all those levels of care. Okay, and who's running those places? Administrators. I mean, these administrators are making very good money. You have to go through your licensing, you have to pay for exams, but if you want to run the show and get paid good money, I'd say go and be an administrator. And having your background where you understand the needs of the aging, which is a perfect match. You have your background with all the tenets of social work, yet you're going to be running a facility that is serving those elderly population. And if anybody tells you that working with the senior population isn't interesting and fulfilling, then I'm sorry, maybe you didn't have a grandmother or grandfather, but they are, I think, the most rewarding population to work with. They have fascinating stories. Some of them, you start talking to them and you realize, oh my gosh, they really were accomplished in their former, while they're in their career. Or then you start understanding why is it that some are aging so well. Some of these old folks, they sure know how to live well because they, for their whole life, have followed a very healthy lifestyle. And that's what living well and doing these wellness programs, are all about how you age well. Well, some of them, they got that message way long time ago.
Cindy, let me jump in and let me give.
Oh, sorry.
Go
ahead, I'm sorry.
Okay, good.
Because students have to be back in class at once. So.
Oh, boy, okay.
Okay, well, I'm really happy to be here, and I kind of have a little bit of a background. I don't have my MSW. I am a licensed social worker with the degree in gerontology, but that's kind of what started me interested. I did want to work with the geriatric population. I have a daughter now that's a nurse, and she's recently moved to working in geriatrics, and I can't tell you how excited I am about that, because I've been saying that's where you want to go.
Yeah.
That's the field of the future. But I've worked as in information and referral at the United Way when I started off my career very early. I graduated. I was embarrassed to tell you because most of you weren't even born then, but I got my certificate in gerontology in '85. So I've been in the field of gerontology and social work, for many, many years. Worked in the governor's long-term care ombudsman. Then I went to the Medicaid agency where I was director of a home and community-based program. So the things that Cindy is talking about, our whole purpose was developing Medicaid services so people could stay at home as opposed to go into a nursing home. So I've always been really interested in that. When I retired after over 20 years at Medicaid Health and Human Services, somebody said, There's a program at the university in the Office for the Study of Aging, which I was their contract manager at DHHS, and they said, we really need somebody to start a pilot program for guardian ad litem services for vulnerable adults. There's not a program in place. The Supreme Court has just said that they're going to quit appointing attorneys to be guardian ad litem, so why don't you come help us start this program? And it was a part-time job, sounded kind of interesting. So I went there, and here I am 6 years later. It is no longer part-time. It became full-time very quickly after I started the program. But the one thing that I do want to say is I was part-time, and the program has really been, I credit MSW students with helping me do that program. I've had a student from day one. I've had some of the most incredible MSW students that have worked with that program. I think by now there's been 5 involved. Now I'm on, because they have to move on, unfortunately. We get them on the second year. But they have really, because there was just no way I could do this part-time. There was no way I could even do it full-time by myself. And we now have an MSW student from Carolina as well as an MSW student from Winthrop. So this is our second year with an MSW student. We developed the program. We got legislation signed in 2015, which is really quite incredible for a new program because that gives you sustainability. Once you're in legislation, you get funded, and we're statewide. We started off just in certain parts of the state. But basically what our program does now is individuals that are taken into legal custody by the Department of Social Services because they've been abused, neglected, or exploited. Some of these also are self-neglect. There's a point in time where the court system has to intervene. Now DSS, the Department of Social Services, Adult Protective Services, works with thousands of individuals every year. Not all of these result in court intervention. But court intervention is when an individual is either taken into emergency protective custody by law enforcement, or the Department of Social Services goes to court and says, Judge, we can't work with this person anymore without court intervention. When they are taken into legal custody, the law requires that they get appointed an attorney and a guardian ad litem. We fulfill the role of the guardian ad litem. So anytime an adult is taken into custody, we get a call from wherever in the state and says, I've got a new adult in custody. Dr. Leith is one of our most wonderful volunteers. She's been through our training. So we operate with 5 staff members. I'm here. I have an assistant director that works with me, and then we have actually 6 when fully staffed regional individuals. All of these individuals are one has a PhD in education, the rest of them are social workers. Retired, a couple of them are retired social workers that actually, have decided to join the ranks of being guardian ad litems. And what we do is we try to recruit volunteers, social workers or other professionals who have experience working with vulnerable population. We train them, and then we actually accompany the adult through the court intervention process. Once the adult is out of custody, then we're done. We're relieved. But we do an assessment of the adult, which of course requires social work skills. We do an evaluation. We prepare a report, and we show up in court. We visit, we talk to families, show up in court with a recommendation to the judge as to what we think is in the adult's best interest.
So I want to open it up to you guys, ask questions, but I want to get us started. Was there anything for all 3 of the panelists in your educational track or anything that you did that sort of steered you towards placement in government as opposed to, working as a clinical social worker, maybe for a home health agency? What made you sort of competitive when it comes to government employment? What was that, if there was anything that you could tell the students? And then feel free, guys, to ask your own questions. So let's start out that way, if each of you. So what brought you did you all start out as clinicians and then ended up in government? Or?
I knew I didn't have the patience. So, no, I was also a non-traditional student. I was coming back, so, and I felt that I had the program management skills and leadership skills to do the bigger picture. And to which, you know, it's wonderful helping out a person one-on-one. There's nothing wrong with that. But I felt I would be more effective helping out hundreds of people. And that's why. And I also think it's very important for you to know, you know, how to get bills sponsored and to follow, you know, legislation, because I was so very blessed by having a very rewarding internship under the House of Representatives and serving on the Ways and Means Committee as one of their first interns ever. And I can tell you, I learned more about politics and bills and legislation and legislators than ever. And I think that's something you really need to know. Because when you had said that you had a bill sponsored and it passed in 2015, that's phenomenal. So you really, it's like, it's not what you know, it's who you know. And that really helps, because you're going to be rubbing it. If you want to see the bigger picture, or you want to do something that hasn't been done before, you've got to know your who's who in your community that can help you get that done. So,
and I think that's such a good point, because I think I knew the direction I wanted to go in. Who helped me was the network.
yeah.
I mean, I had good friends, I had made contacts, I had established relationships,
Exactly.
you know, and I really think that helped. As a state agency and even working at the university, we could not lobby ourselves at the
Right.
State House. Hey, fund me, I've got this great program thing. So we had to depend on the network. AARP, Silver Hair Legislature, I mean, the South Carolina Bar, Elder Law Committee, all of those people that I had been in meetings with, that I had worked with, had professional affiliations. That's really, you know, what
I think it's really key. And you have to know these people. It's not, and you know, it's wonderful that you want to help people, but it takes money. I mean, it just takes money. I'm a registered Republican. I know it just takes money. I want to do good for everyone, but I know it also takes money, and you have to be fiscally responsible for your program. I mean, how are you going to manage it, make it work? How are your outcomes going to be impressive so that you'll get funding, or even funding again? Sometimes you're on that, you know, fence with whether or not you're going to get funded again. So you always have to keep your outcomes and your accomplishments in the forefront, where your backers, your financial backers, whether it be government, because government could say no and cut the budget at any given time. So you really need to keep that in the forefront. I mean, you know, the do-gooder social worker is wonderful, but really get your ducks in a row as a sound business person and understand what is going on with your funding. Where is it coming from and who's controlling it? So, and a little sidebar commercial. You want to know where to apply if you're living in South Carolina? This book is on our website. This contains every resource, every nonprofit, for-profit, every service that for the aging or disabled, and it is on our website. So if you go to centralmidlands.org and you go to service banner where it says services, you click on services and you'll see aging services. That'll bring you to the Area Agency on Aging homepage. And if you scroll down, you'll see the hyperlink for the link for this. This is 185 pages. I'm going to pass this around. I'll just pass it around, flip through it really quick. You can download it. If you want to buy a copy, it's $20. But all of that goes towards feeding a senior. So you can have, and that's got everything in it from. And also HHS is hiring, by the way, working with a dual eligible program called VIP First Choice Plus. It's a dual eligible program, and they hire navigators. And there are also nurses. They can be nurses or social workers, because George Boggs talked to her. I sit on their advisory board. She says, yeah, we're hiring social workers. So, and that's where you're going out to somebody who is dual eligible, Medicare, Medicaid, and you're helping them get their services that they're eligible for under their insurance plan. So, not sure. So, but you know, they're looking, and I'll tell you what, a lot of times it's your skills. I mean, you have a degree, but your skills and the way you present yourself is going to sell you more than anything else. You know, I'm going to be old-fashioned, be on time. You know, look professional, talk professional.
But Cindy, so specifically, is there a skill set? For instance, Michelle at GHIC, is there a specific skill set that a government organization is going to look for in an MSW student that will make that student more attractive? So, like at DHEC, what's the difference between an MSW and a public health student? What could that social work student do to make him or herself more attractive?
Well, I ended up in the government because I wanted to make a difference from a bigger level. I've always known I want to do more, we called it back in the day, macro social work. I wanted to work with systems and organizations, and I didn't want to work directly with individuals. I had done direct service, I had my bachelor's degree in social work, and I was burnt out. I was literally burnt out, and realized that that was not where my skill set lay. And I realized that my skill set really laid in organizing and identifying partners to bring to the table to make things happen from a larger perspective. As far as the type of degree that you have, as far as the MSW, most of the programs at DHEC pretty much say a master's degree and 2 or 3 years of related experience. So when you say related experience, what you're looking at with most of the positions like PC2s, which are program coordinators 2s, or managers, you're really looking for someone who can coordinate. You can coordinate, you can plan, you can develop programs, because that's a huge thing, to being able to develop a program. It's one thing to identify an intervention, but can you make it happen? And then can you adapt it to the environment and to the population you're working with? So that's a skill set, to be able to say, well, you know what, this worked over here, but this really may not work over here. That's something I really learned in minority health. When I was in minority health, we learned that a lot of the things, cookie cutter, don't work in minority populations. So we had to tailor things and change them a little bit. So you have to be flexible with that. You have to be able to see down the road and see what your outcome, what you want your outcome to be in order to be able to reach it and figure out how you're going to get there. So really your skill set, you have to be able to plan, implement, evaluate, because like Cindy said, you have to, if you don't evaluate and you can't tell people what your outcome is and how good it is, nobody's going to listen to you. You're not going to get additional funding, you'll be cut off, it's not going to happen. So you have to always show what your outcome is. And you always have a clear idea of what you want to happen. I can't say that enough, because many times you go into something and say, it's a great program, we're going to do this. Okay, so what do you want out of it? How are you going to get there? You always have to know what that end result is, and then think about that end result as far as sustainability. Okay, so when we get there, how are we going to keep it going? And then once we keep it going, who are we going to bring to the table? So partnerships, and like Cindy said, your relationships are essential. Essential. Whoever you know, when you meet people, let them know who you are, what you're interested in, and you'll be surprised at the connections you can make. It's a very small network, especially in public health. I must say I run into the same people at mostly all my meetings. So you don't want to burn your bridges with anyone. You always want to make sure that you are always professional and always honest and upfront. But those skill sets are the most important. And being outgoing. I mean, I'm an outgoing person, and I know that has helped me a great deal. And if your personality is not outgoing, just work on it, because it is something that you really need to do in this type of work. In public health, you have to remember what we're trying to do is improve outcomes. So our whole thing is looking at it from the population perspective. So always knowing that, this is not, what's good for one person is not good for everybody. But there are some things you have to do for the good of everybody to be able to make an impact to see the results 10 years later. So patience. Patience is another skill set.
So I really want to open up to you guys. Feel free to ask the panel questions. Just go ahead. You have no hand raising, just go ahead, shoot your questions.
I actually thought, because I got a BSW from Leith City, that's North Carolina, and I agree, I didn't want to do direct service because we had to do internships and I was over it. I thought it was going to be kind of hard getting into working in a government agency, but from talking to you guys, you just have to go for it. Yeah.
And for me, I started at the community level. I mean, the direct service is good, but you need to do some program planning. Program planning is your bridge.
That's my specialization, I plan next
You have
year.
to, exactly.
So
You
I
can
can
plan,
be in the middle
implement,
and
exactly.
impact all levels of organizations.
And that's the type of skill sets we're looking for.
Right.
For like PC2s and program coordinators, that's what I look for.
I have a question. Oh, after you say anything.
Well, I was also going to say that I work for a nonprofit for
That's why I
I've been
started.
out of way,
That's exactly
so
why I
that's a real good way
Yeah.
to get your feet
That's a good point.
Yeah.
Maybe don't start out at the state level,
Right,
the state level,
right.
but start with a small not-for-profit and then work your way to state level.
That's exactly how it started.
Yeah. Yeah, I volunteered to write, or be a grant writer for the Richland Lexington Council of Arts. I said, you know, I have a little knack for it, so I started getting more grants under my belt, you know, bigger and bigger. And so that, you know, so sometimes, and sometimes it's volunteering for a project.
Right, true.
You know, so you can work with somebody, you know, try to find somebody that can mentor you. You know, if you really find, you know, you're young and you know, you don't know everything, I didn't know everything, but if you work under some really talented people, they're gonna teach you something, and they don't mind.
Well, they teach you grant writing here, so I'm interested in grant writing.
Writing is extremely important.
Yeah, your writing skills, if you can't write well, work on it. You really do need to write, so. And it's not, and it's okay to ask for help. If you got somebody whose mom is an English teacher, just, you know, teach me. So that's it. Eventually, those things you're gonna absorb, and you're gonna, you know, I didn't get here today because I didn't ask, or and I have a very curious nature. So I think that's also helps if you're curious. Or how I can figure out. Now you got the internet, you can figure out anything. So, that's cheating. I had to figure it out the hard way, but I think you've got a lot of opportunity.
I think I had some question over here.
Yes, we also want to say something.
Well, I just wanted to say that the 4 regional coordinators that I've hired started off as volunteers. They actually went through our volunteer program. They actually started off as guardian ad litem, and then, you know, when the jobs became open, you know, they said, "Would be interested?" And I'm like, "Oh my God, you would be interested in doing this full time?" And it
Or
was just
dementia dialogues is a similar program.
Yes,
Mhm.
yes.
Yeah, and I hired one of my interns, so you never know.
Many interns.
Go ahead.
I've been doing some reading lately about LGBTQ discrimination in the elder population. I was wondering if there are any programs in South Carolina or people working on developing
State
programs to combat that.
You use the acronym, I'm sorry. I didn't think-
LGBTQ,
Which is,
lesbian, gay, bisexual,
Oh,
transgender,
excuse me.
queer.
I haven't heard any in South Carolina.
Okay.
No.
I'm sure they did hear some.
Yeah, I did too.
Okay.
I'm trying to think. No, I was trying to think where I was. I think we were in that same meeting actually.
Yeah, maybe
There's somebody did a study on it, I know. They did a study related to how health outcomes with those communities. What was that? I think it was someone at the university. I think it was someone.
Yeah,
at
and
the
I can
university.
tell you, I work as a grant reviewer for the Administration for Community Living and for the Administration for Children and Families,
Okay.
and so at the federal level. And they're just starting to look at programs that are, they call it culturally sensitive, to be inclusive of sexual minorities. So they're just starting to look at that, and so some money is gonna start coming down, and programs traditionally that weren't maybe focused on that, need to start focusing on that more. So there's beginning opportunities there in that area.
And you can see that through AARP publications, they do address that. It's being addressed in the major publications and major organizations, national ones.
I think there were some questions back there. Go ahead.
This is more specific towards the senior centers and the area agency on aging. How many ombudsmen do you have? Do you have one for every county, or do they?
Well, my office, we have 4 working in the ombudsman program, 2 investigators, then there's a coordinator for taking in all the data, and then there's also a friendly visitor coordinator. That's also another federal mandate to get volunteers to go and, of course, do that friendly visitor, or be a friendly visitor in the facility. So, but it varies for every area agency on aging, just depending on how many counties they have under them and their population that they serve. Appalachia, Upper Appalachia has 8 counties, and they've got 7 staff in there. So,
And do your programs tend to run a wait list, like
oh yeah,
most of them do?
oh
And
yeah.
I know that's probably got to be.
There's never enough money for meals.
Yeah.
There's never hot home delivered meals. There's never enough. I mean, you're working with churches, Meals on Wheels, the Council on Aging that I fund. They write grants, they get donations. I mean, it's just never enough because the senior population, I don't know if you've ever heard the expression, the silver tsunami. That's what it is. I mean, there is just so many seniors out there. But there's waiting lists for meals, certainly homemaker, those homemaker services I spoke of earlier. Yeah. never enough funding. And the federal funding hasn't kept up with the seniors. So you have to get very creative on writing more grants and asking for donations.
And a note of interest, we are the 5th fastest growing state for the aging population.
Yeah. We know old. Plus, we're also very good to retirement. So we're in the top 10 in the nation for South Carolina for retirement and taxes and your estate. You can have, over 2 million now without being taxed. So actually for some of the seniors that do have money and will never call on my agency for help, it is a very attractive state to retire in. So no, if you know old, you can work in South Carolina.
Any other questions? What else is questions? Go ahead.
You guys have mentioned volunteering, but other than jobs, what would you say have been some of the best sources of networking? Are there different groups that you're a part of, or is it just the interactions that you've had in your particular jobs or the places that you volunteered or interned?
It's been a long time since I was an intern.
It depends on your interest
Yeah.
level, what
Yeah.
you're interested in. If you think you're interested in a specific area, you would want to seek out someone in that area and find out what you can do. Like for one of the programs we offer, we do chronic disease self-management programs. So someone may want to volunteer to become a leader to do that. And that would give you a feel of the community and also from another level. So it's kind of like identifying what you want to do, what you think you want to do, and just kind of identify those people. I mean, it's not like there's real organizations, I don't think, that do that except for the university for your internships.
What's DHEC? Can you say what it stands
DHEC?
for?
South Carolina Department of Health and Environmental Control.
Oh.
We're the public health agency for the state.
Public health department.
And we're also, we're unique, there's only one other state like us that has the health and the environment together. So really, actually, you can look at both sides of it. You can look at it from the environmental perspective as well. So it's a large number of things you can do within the agency.
But keep in mind that a lot of these projects, the program that Ms. James is mentioning, is actually collaboration between the Lieutenant Governor's Office, which is the state unit of aging, and DHEC, which is the state unit for the public health agency. And so that is required by defect to be a collaboration between those two. It's not that you say, oh, public health, that's not me. Social work and public health have a great affinity with each other.
And you have to work together.
Yeah.
And a lot of the, like she said, the funding sources require that.
Yeah. Yeah. And so I think
We enjoy it.
both Ms. Pat and Ms. Curtis can speak to the fact that what you're doing touches on health. I mean, you can't, it's not that you say social work and health, that's the two don't hang together. They're very, very much overlapping, right? Who else? Who else has a question? Go ahead.
So, this is for Maria. When you mentioned that you helped with passing bills, now was that with your role as Lieutenant Governor or with the Lieutenant Governor office, or was that with the NASW that you're associated with?
Actually, at that point, I was at the Office for the Study of Aging, which is
Okay.
part of the School of Public Health at USC.
Uh-huh.
That's where the pilot program got started.
Okay.
And we worked with an entity called the Adult Protection Coordinating Council, which is a legislative body. It's mandated by legislation of professional agencies that work in adult protection. And they actually had a legislative subcommittee. So we worked hand in hand with them in actually writing the legislation. And then once the legislation got written, then it went off to people like AARP and Silver Hair Legislature and Alzheimer's Association and actually powerful entities that could actually lobby it for you.
Are you working on any bills right now?
No. We have just moved to the Lieutenant Governor's Office on Aging. We just moved there July 1st.
Okay.
The legislation made us a part of the Lieutenant Governor's Office when it was signed in 2015, but they left us at the university for a year. And so we're just moving. But, you know, I think there's a lot of, there's not a lot, but there is some legislation going on about with Adult Protection Act because of all the scamming. You know, lots of things of trying to, you know, to protect the elderly. So I think, you know, there's human trafficking legislation that's been talked about. I mean, there's a lot of legislation. I think you're going to see it in the next few years because we have such a huge population growth.
Are you familiar with the senior patrol?
Senior patrol,
Medicare
yes.
senior patrol, so there are some areas that are sort of coming that has to do with, taking advantage, financial advantage of older adults. Fall prevention is a big thing right now for older adults because falls cause death in older adults. So that's a big one. As I was mentioning, sexual minorities, that's sort of starting to be a focus. Did you have a question?
I had another one. Sorry, I'll probably have tons of them. So, with like the economic downturn and everything, like recently, I've noticed an increase in multi-generational homes. Are you still allowed to do assistance for people in that kind of situation? Or how is that impacting you guys? Or are you seeing an increase of that?
Well, we certainly over the caregiver support program see that just because of maybe even as I mentioned, a granddaughter taking care of the grandmother, and she's married and she has a husband and a child she's taking care of, but she's a caregiver for a mother. So there is assistance. A lot of it is the Older American Act says that we need to help out the neediest. So there are some case-by-case review where we need to see if it's how much assistance they need or even if they even qualify. But generally, if you're a caregiver taking care of someone, you qualify for at least a respite assistance. But it's harder with people trying to understand that Medicare does not pay for their long-term care. And, we get calls all the time, like, well, mom has Medicare, so we'll put her in the nursing home. No, it doesn't work that way. Medicare is just like your own health insurance. You go to the doctor and you can get your prescriptions and you can have your surgery, but it's not going to put you in a retirement community for the rest of your life. And that's why it's so important to have all these services coming into the home, because does anybody have an idea of how much it costs to go into a nursing home?
At least $5,000 to $10,000 a month.
Right, yeah. Like tuition, yes. So, but unfortunately, they don't give you any loans to go to a nursing home. You got to pay between $5,000 and, you get what you pay for, but it's around $8,000 a month for you to live in a nursing home. So you can get somebody to come in for several hours a day. And like I said, there's lots of coordinators, schedulers, people are managing these companies who are scheduling the right kind of care for you to come into your home for several hours. That'll help you get dressed, it'll help you get a bath, it'll straighten up your home. Maybe make you a couple of meals so, and that way you can stay in that home just a little bit longer.
One thing that I wanted to say too, kind of on top of this, is the largest group of individuals that get taken into legal custody is because of self-neglect. So as we have a larger group of people living longer and somehow, their spouses died, or even the daughter that was a caretaker died because she was in her 70s or 80s herself. So we're seeing more and more people that, are wanting to stay home. And, they just get to the point that, they don't know how to reach out for help, or there's not enough help to keep them in their home. So, that's a really growing program because people do want to stay home. So we need to be focusing, our attention and our money on, at-home dollars as opposed to nursing home or.
It takes a lot when you have, because people will call, it's firemen and police coming out to the home to check on them. Some of these people are living like on $570 a month. So, because they retired and they thought their pension or their Social Security would help them, but of course everybody understands inflation in this room. So you really have a population that, we have to advocate for. And, the good thing is a lot of legislators are getting up there themselves, and so they understand it, but in a way they don't, because they're pretty well off, most of them.
And then you look at the dementia aspect that goes on in there, which is it's a growing number. And we are growing quickly in South Carolina with that dementia and Alzheimer's disease. So you have an older person that wants to stay in their home but can't and take care of themselves. Many times they can't take care of themselves because they are having the cognitive difficulties. So that's why the awareness is so important for people to understand what those signs and symptoms are to get them help, because that leads to worse health conditions and worse health outcomes and everything else. So yeah, it all ties together. Keep them in a home.
I have a question over here and a question back there.
I wanted to piggyback off of the comments that you were making earlier, and Cindy, you did leave out the Seniors Raising Children program, where a lot of the focus is on the general caregiver, where
whoever the person is, they're taking care of some kind of senior, whether it's a spouse or parent, whatever it may be. But that multi-generational component, you mentioned that there's a lot more grandparents raising their grandchildren nowadays, and there's a component for funding for that as well. And essentially, the reason why these things are being funded is because we're saving the state money. There's not enough facilities to house these senior citizens. So,
Or put their kids into foster care.
or any of that either. So
Yeah.
at the end of the day, we're saving the state money.
That's right. Go ahead.
Oh, no. I was listening to a social work podcast and you mentioned dementia. It kind of reminded me. So is more, how do I explain? Because like one thing that they were creating with the dementia was like communities that, because when people get dementia, they can sometimes get in a frame of mind that they think they're like in the 1950s or something like that. And they would have like a city that's created, and each house has its like each theme. They've had success with this in a town in or like a community for this in, I think it was like Switzerland or somewhere, and I think they're starting to make them in Florida. But is that something that, with the rise in dementia in the elderly population, is that some research that people are starting to look a little closer at? And
I don't know if you're looking at that specific strategy. I think it's a good strategy. But again, it's really, first of all, you have to change the tide of thinking in the state that this is even an issue. Many people don't even think that dementia is an issue. There's really no money funded behind it. Even in public health, I'm working very hard to get people to see that this is a public health issue and not just an old people's disease. So the whole paradigm has to shift for people to start looking at that. And I think we're a long way off in South Carolina for that, unfortunately.
These are living communities that they have, and they work very well, even
Yeah.
if you're aging, because everything is in a community setting. But unfortunately, that funding hasn't, matched. Some of the retirement communities that are corporate owned, they're doing those.
And then we have to work on the environmental system change. There are some communities that are making it more friendlier for older adults and for all ages. So we have funding out in the communities to do that now through GHEC, to make those things accessible, food accessible, those walking accessible, that kind of thing. But that's a little different, yeah.
I mean, I wrote a grant for Project Lifesaver. It's on the internet, but it's also getting a tracking device, and it's through the sheriff department. So if your loved one wanders, you are given this bracelet, and at least they can find you within, even if you leave the house and they wrangle off the bracelet, they can find you generally within 30 minutes. So there's lots of things you can do. That's grant writing. That's something that we enhanced at my AAA. So now every county has a Project Lifesaver program through the sheriff department. But we bought all the equipment and did all the training.
I'm going to give you the last word because you have about 5 minutes left.
It seems like you guys have a lot of things under your belt. When do you have time, when do you have time to inform the outside community about
Right here.
awareness, like fairs? Do you guys do like fairs?
Our programs, all of us have, at least mine, we have to do, each program has to do a couple of outreaches every month. So we go to churches, we go to outreach,
And all our work is community-based, so we work directly with the community.
This is actually an example of it, right?
Yeah.
Okay, another way.
So you all have to tell 20 people.
That's right.
And speaking of that, we are doing, just one plug, we are doing 10 demonstration workshops across the state to raise awareness of Alzheimer's disease. And that information is coming out soon. I'll make sure to forward to you. And what it is, it's going to be a 2-3 hour workshop where you see 1 hour of the 10 warning signs of Alzheimer's, and then the second one is healthy body, healthy brain. And we're hoping that people will either want to be trained to go out and give these workshops or be able to bring it back to their organizations. So I'll be sure that you get
Extra credit? You can get extra credit.
It's extra credit on your resume.
Join me please in giving up. And if you want to come up, I think I see Cindy with some cards and then we have a handouts and I'm sure Michelle will be happy. Thank you guys.